My name is Eliza Marks, and I am the pharmacist with the Florida Hospital Transplant Center. Today, I'm going to hopefully give you a complete idea of all the medications that you'll be taking after the transplant. So we'll go through every medication, we'll talk about why you have to take each medication, what the side effects are, and hopefully give you a complete idea of how your medications are going to look after the transplant. So the way that it works when you receive a transplant is if we put the transplant into your body with no medication, then your body is going to create a big immune response and attack or damage the new organ. The way we get around that is through medication, and we start the medication the day of the transplant. So you're going to get a medication called thymoglobulin. You get that starting during surgery and for the next 3 days, and then that medication will last in your blood for the first 8 to 10 weeks. So your immune system is going to be very suppressed for the first 8 to 10 weeks because of that medication. The next 3 medications that we're going to be talking about do not suppress the immune system as much as the IV medication will, but these medications are necessary for you to take forever. The names of these medications that we're about to review are prednisone, CellCept or Myfortic, and Prograf. The first medication is prednisone. Prednisone is a medication that everybody will get during your hospital stay. We start the prednisone on the day of transplant, and then we will stop the prednisone the day you leave the hospital if the physician feels that you are low risk for rejection. If you are high risk for rejection, then the prednisone will become one of your permanent anti-rejection medications. So this is a medication that you may or may not be on for life. Prednisone comes with a lot of side effects. Some of those side effects are diabetes, cataracts, osteoporosis. It's a medication that we will try to get you off of if there's any possibility that you can be off of it. CellCept and Myfortic are medications that everybody takes that gets a transplant. It's a medication we don't have to monitor. There are not many side effects associated with the CellCept. Everybody gets it. The last medication is the most important. The name of that medication is Prograf. Everybody gets it. It's a medication that has to be monitored for the rest of your life. The last immunosuppressant medication is Prograf. Prograf is the most important of all of the immunosuppressant medications. It's a medication you will take for life. It is a medication that has to be monitored for life. So this is a medication that works on blood levels. When you're first transplanted, we will bring you into clinic to get blood levels taken 2 to 3 times a week for the Prograf. Over time, you will only have to have this medication monitored every other month, but it will have to be monitored for the rest of your life. These medications all work by decreasing your immune system. There never comes a time that your body becomes tolerant or used to the kidney, so these medications are necessary for the success of the transplant. So the rest of the medications that we're going to talk about are important, but the ones that you need to focus on are these first 3 medications. The next group of medications that we're going to talk about we call prophylactic medications. These are medications that are going to prevent different types of infections that are hard to treat but easy to prevent after the transplant. They don't prevent you from getting sick completely, but they do prevent different types of infections that pop up in a person with a lowered immune system. The names of these medications are Septra or Bactrim. This is a medication that prevents a type of pneumonia called pneumocystis or PCP. Valsite, which is an antiviral medication which protects you from a virus called cytomegalovirus or CMV. And then the last medication, which is called clotrimazole, protects you from getting something called thrush, which is an infection you can get in your mouth after the transplant. This group of medications are taken from 3 months to a year, depending on your nephrologist and when your nephrologist feels like we can stop them. The last group of medications is just to give you an idea of other medications that we might add to your list. These are not permanent medications. These are medications that are added on a case-by-case basis. The first group of medications on the list are blood pressure medicines. These are medications that you will take depending on if your blood pressure is high or not. So we start off with a medication called Norvasc, and then we're going to add blood pressure medications depending on what you were taking prior to the transplant. This does not mean that if you have low blood pressure that you have to take a blood pressure medication, but generally most of our patients go home on at least 1 blood pressure medication. The next group of medications are your stomach medications. If you go home with a steroid, which is prednisone, then you must go home with a stomach medication to protect your stomach from those steroids. So this group of medications would include Pepcid, Prilosec, Nexium, one of those medications. The last group of medications are your pain medications. The way that pain medications work after the transplant is you start out in the ICU with a morphine pump. Once you get transferred to the floor, we will switch that to an oral medication called Percocet. And then on discharge, usually you're ready for a medication called Vicodin. So you get Vicodin as one of your medications on discharge to control your pain. I want to review with you the importance of compliance with the medications. If at any point after your transplant you do not take the medications as prescribed, or if you stop the medications, you will have a rejection of the organ. After the transplant, we like to have full control over all medications that you take. So if you end up in another physician's office with a new prescription, we want you to call us first before you get that medication filled. This also includes over-the-counter medications. We would like to know everything that you want to take or need to take before you take it. This includes all over-the-counter medications, vitamins, supplements, herbal supplements. We would like for you to avoid all of those. All of these medications can have drug interactions with your anti-rejection medications, which could increase or decrease the levels of those medications and either cause toxicity of your transplant medications or cause them not to work. As far as the medication schedule goes, you will be taking medication twice a day. You will be taking 30 to 40 pills per day, and we divide these into 8 o'clock in the morning and 8 o'clock at night. So you will be taking a chunk of medication in the morning at 8 o'clock and then less medication at 8 o'clock at night. If you have trouble swallowing pills, we would like to know before the transplant so we can make arrangements for you. Insurance issues become very important after the transplant. You need to be very aware of how your insurance works and what your copays are. The cost of these medications without insurance is $2,000 to $3,000 per month. So you need to know exactly what your insurance is going to cover and what your insurance is not going to cover. When it's time for you to be discharged from the hospital after the transplant, the medication will be delivered to you by the Florida Hospital Community Pharmacy. The medication will come in a 30-day supply, and they give you a package with a free blood pressure monitor, a free pill box, and a thermometer. The medications that I just spoke about are the key to the success of this transplant. I will review all the medications again with you in your room once you are discharged. I look forward to meeting you.